After any surgical procedure, it is completely normal to experience some degree of wound drainage as your body begins the healing process. However, knowing what is normal and when a particular discharge might indicate a problem can be a source of worry. It is important to feel confident in recognizing these signs so you can ensure a smooth recovery and avoid unnecessary stress. You should call your doctor for wound drainage whenever you notice a significant change in its appearance, an increase in quantity, or any accompanying symptoms that cause you concern. This includes drainage that becomes thick, yellow, green, or develops a foul odor. Prompt communication with your healthcare provider is key to addressing potential issues early. The reason certain types of drainage are concerning is because they can be indicators of infection or other healing complications. Initially, a small amount of clear or pale yellow fluid, sometimes tinged with a little pink or red, known as serous or serosanguineous drainage, is typically part of the normal inflammatory phase of healing. This is your body's way of cleaning the wound. However, if the fluid turns a darker color like yellow, green, or even dark brown, and especially if it becomes thick or cloudy, it strongly suggests the presence of bacteria and a potential infection. This type of discharge is called purulent drainage, and it requires immediate medical attention to prevent the infection from worsening. To assess your wound effectively, routinely check the drainage for its color, consistency, smell, and the amount present on your dressing. Pay close attention to changes over time. For example, if you initially had clear fluid and now notice it is consistently yellow and thick, or if the amount of drainage suddenly increases, these are important details to relay to your doctor. You should also watch for other symptoms like increasing redness around the wound, warmth to the touch, new or worsening pain, or a fever, as these often accompany an infection. Understanding the difference between expected fluid and problematic discharge empowers you to be an active participant in your recovery. While a little clear or light pink fluid is usually fine, any signs of pus, a bad smell, or an unexpected increase in the amount of fluid means it is time to connect with your care team. Recognizing these specific indicators helps your doctor quickly determine if intervention is needed, potentially saving you from a prolonged recovery or more serious health issues. Ultimately, trusting your instincts about your body is paramount. If something about your wound drainage just does not feel right, or if you have any doubts at all, do not hesitate to contact your doctor or their office. It is always better to err on the side of caution and get professional advice rather than waiting and potentially allowing a small issue to become a bigger problem. Your healthcare team is there to support your healing journey and wants to help you achieve the best possible outcome.